Nurses need to be aware of different contraceptive methods, and there is a box 43 on page 950 in your book that goes through some of those methods for you to get familiar with. Do what? Be familiar with them. 950, it's box 43, 40-3. You also want to educate your clients on avoiding or dealing with sexual harassment and abuse. Teach them what are appropriate versus inappropriate behaviors. Also tell them about their rights and what support services may be available. And we'll talk more in depth about intimate partner violence and things like that in the spring when we go through those lectures on psych. You want to offer counseling for anyone who's having altered sexual function. For patients who are experiencing difficulties, there's the implicit method, which is laid down on your slide there. The first part of it is permission giving. So that's giving them permission to talk about the sexual things, to be a sexual being. You want to be sure you acknowledge their sexual concerns and encourage the expression of any sexual concerns. The next one is limited information. So you want to offer them accurate, concise information. If there's someone who's having a procedure or has been ill, provide instructions on when and how to resume sexual activity following illness or procedure. This is especially important, like for clients who maybe had a heart attack or something like that. They may be really worried about that, when to resume it, whether it's safe to resume it. So sometimes those things that are totally unrelated to those areas can also cause complications in their sexual health, though, because of concerns. Discuss sexual side effects and when to notify a provider for possible medication adjustment should sexual side effects arise. Sexual side effects can be a major issue in compliance with medications. Once again, another thing we'll talk about more with psych. But if that is a side effect that medication may have, you want to tell your client that's a possible side effect, and you want them to know to call before they just stop taking their medication, so you can try something different because of that side effect. The next one is specific suggestions. So you want to give them specific knowledge about sexuality and functioning, how it's affected by whatever their disease process may be, what interventions may work. And as we move down the scale, at this point, it may require a specialized skill level. So if you work in a specialty area, you're more likely to kind of have the knowledge that you need to inform your patients about specialized procedures. Then the last one is intensive therapy, and that is one that will require a specially trained professional to give them intensive therapy into sexual function issues. Okay, we're also going to talk about inappropriate sexual behaviors, and this has a lot to do with not just out in the public, but with what we sometimes are exposed to as nurses. And I think some of my students even had this experience like first or second day at the nursing home where they walked in and someone was exposing themselves inappropriately, called them into the room and then was exposing themselves inappropriately to them. So these are things that you will run into in your practice. So inappropriate sexual behaviors. The first one is exposing oneself. Asking for care that is inappropriate. Touching or grabbing the nurse, making sexual statements, offering sex, or making comments about the nurse's attractiveness, or doing things like whistling or catcalling, things like that. The next part of the slide shows the reasons that may come behind that, and I want to make sure that you know that that's not intended to make those behaviors sound acceptable. We don't want to accept those behaviors, but it is intended for us to kind of help understand why our clients might be exhibiting those behaviors, what might be the underlying factors that we could actually deal with besides just the behavior. So those sometimes come from fear, anxiety. They may have unmet needs for intimacy that are leading them to partake in inappropriate behaviors. They may misinterpret the nurse's caring behavior. So as nurses, we talk about therapeutic communication and therapeutic touch, and sometimes you may care about someone in your nursing role more than they're getting cared about anywhere else, basically. And so they sometimes may misinterpret that as you wanting to establish a relationship beyond professional. They may need reassurance that they're healthy and vital and are still a sexual being, and that may be what they're looking for in getting that attention. They may just be seeking attention. Sometimes those behaviors are due to confusion, possibly due to like some neurological impairments or trauma. So sometimes when we get certain types of brain damage will cause us to not have the same inhibitions that we would have had at other times. It's also true of medications. Sometimes will change our inhibitions and cause some inappropriate behaviors. They may also be trying to exert some kind of power or control while they're feeling out of control in their life. And there's even some societal pressure, kind of that sexy nurse portrayal, and we even saw those memes in Halloween, probably some of you guys did, that so they may believe that that's just expected, that patients are supposed to comment on their nurse being attractive or sexy from that cultural pressure. The first thing that you need to do is ensure that the behavior is meant to be inappropriate and that's not a way your client's expressing needs. And this, got close to this in a sense, but your client may be grabbing their private area repeatedly because their catheter is hurting, or they have some kind of infection going on down there. So consider, or grabbing other areas for those reasons, consider if there's a physiological need that's prompting the behavior before we just assume it's inappropriate and ignore it. There are some other strategies on page 951 in your book. Box 44 gives you some specific examples of what you can say in these situations. 951. Yes. And this next slide talks about menopause and sexual dysfunction. We've kind of covered those for the most part. We'll talk a little bit more about menopause because I'm not sure that it's going to be on that lecture capture, so we'll go back kind of through that a little bit since it was early on. Menopause occurs as ovarian activity decreases. Eventually the menses cease entirely and ovulation ceases entirely. Typically occurs between the ages of 40 and 55. The average age is about 47. Periods will typically be irregular before they cease completely. We talked about the emotional effects that can occur. Can be a relief to some people, or can be emotionally hard on them depending on how they define their role or what their childbearing experiences were. The signs and symptoms occur due to decreases in estrogen and decreased ovarian activity. So they may have hot flashes or they may be chilly. The breasts may become smaller and less dense. Metabolic rate drops. Osteoporosis increases. Insomnia and headaches can occur. And then they have decreases in vaginal lubrication and elasticity, so they may need water-soluble lubricants. Now we kind of already talked about, as far as sexual dysfunction for men, there's a wide range of possible treatments, from oral meds all the way to implantable devices. The most important thing as a nurse is that you're asking questions about sexual health as part of overall health, that you're educating on any misconceptions they may have about continuing sexual activity into older adulthood, that you're encouraging your clients to seek treatment options rather than just assuming it's a natural part of aging. You don't need to know specific meds for sexual disorders for today. Then evaluation. And don't get too excited when we have to go and backtrack back to where we skipped over earlier. We're not quite done. Evaluation. So you want to make sure you've identified your client's risk factors. They have expressed their fears and concerns to you. They're feeling increased comfort in talking about sexual behaviors and sexual health, that they understand your teachings, and they'll follow up with, having them teach it back to you, or talk about different signs and symptoms of STIs, talk about STI prevention, talk about pregnancy prevention. Be sure that everything that you did was compatible with their culture and religion, and you want to evaluate the client's readiness to move forward in promoting their health. Okay, so let's move back now, and we'll talk about a little bit about self-concept, way back to the beginning. Okay, so self-concept is one's mental image of oneself. If it's positive, no positive self-concept, you're going to develop better interpersonal relationships. You're going to adapt to change better. You're going to have improved resistance to physical or physiological issues. What makes up our self-concept? There's several things there. Our personal identity, our body image, our self-esteem, and our role performance. So our personal identity is the conscious sense of our individuality and uniqueness. It's who we are. It includes our beliefs and values, our personality, our character. Kind of gives us a feeling of integrity, continuity between all of these other pieces. We kind of have a positive, accurate self-concept, kind of ties everything together. We feel genuine about who we are. Body image is, of course, how you perceive your body appearance and function. This can be as a whole, or it can be individual parts. There's a cognitive portion, which is the knowledge about your material body, like what you actually physically appear, how your body appears. There's also an affective portion, which is about sensation. Body image goes with both of those, like not just what you actually know about your body, but how you feel about it as well. It is highly influenced by others' attitudes and responses to your body. The more closely your body matches your view of the ideal body for your culture, the more positive your body image will be. Positive body image contributes to a healthy sense of caring for health and appearance. Whereas in a negative body image, we may get so focused on minor issues or areas we want to change and neglect overall health promotion that would have had a greater benefit to the person. True body image disturbances may be noticed when a client refuses to look at or touch a certain body part that may have been altered due to injury or illness. Self-esteem is your judgment of your worth. So globally, it's how much do you like yourself as a whole? Then it can get specific to how much do you approve of specific parts of yourself. Like body image, it's heavily influenced by other people's opinions as well as your own. It's heavily influenced by your early experiences in your family. And also illnesses that are viewed negatively by society may lower self-esteem for our clients. And then role performance. A lot of little things under there. So role performance basically has to do with how you compare to the standard for that role. Now we all have a lot of different roles, so we can be talking about our role as a daughter, our role as a mother, our role as a student, our role as a nurse. Can be work or home or different things. So role mastery is when your behaviors meet the expectations you have for that role. So when you're doing well in the role, you feel like you've mastered the role. That's where that comes from. Role development happens as you socialize yourself into a particular role. So it happens here as you guys begin to develop a sense of how you'll behave in the role of a nurse. So you're doing that currently. You're developing who you're going to be as a nurse. So that's role development. Role ambiguity happens when the expectations for a role are unclear, when we're not sure what we're supposed to do or how to do it, and we can't predict how people will react when we try to take on that role. Role strain occurs when we have frustration that develops due to feelings of inadequacy. So we don't feel like we're mastering our role and we get frustrated because of that strain. Role conflicts occur when we have opposing or incompatible expectations, sometimes because people have different views. So when one person sees the role as something different than another person. It can also happen as a nurse when a healthcare situation you're put in conflicts with your beliefs or values. You may have role conflict on how to handle that in your role as a nurse. What affects our self-concept? You'll find that much of it is the same stuff that we talked about with affecting our sexual self-concept. Stages of development. So our self-concept can vary through different ages. Teenage years are rough sometimes. We're really hard on ourselves as teenagers. Sometimes as we get to older age, we kind of just accept who we are and we're not as hard on ourselves anymore. Family and culture obviously influence your development. After early childhood, your peers begin to influence your self-concept. Sometimes conflicts occur between those two different expectations, between who your family sees you as and who your peers see you as. Stress can actually go either way on your self-concept. If you feel like you've been able to overcome a stressful event, that will probably actually build your self-concept. Whereas when the stress feels overwhelming, your self-concept begins to decline instead. Resources affect your self-concept, either internal or external resources. Internal can be things like your confidence and your values, whereas external, like your support network, finances, other things like that can affect your self-concept. Your history of successes and failures affects your self-concept. If you feel like you've had constant failures, you're going to see yourself maybe as a failure. If you feel like you have lots of successes, you're going to feel more successful. Illness and trauma. Another one that can be viewed differently. It can alter how you see yourself based on the illness or trauma. It depends on how it fits in with kind of what your role expectations were and how they affect your ability to continue to perform your roles sometimes. Kind of like stress, if you see yourself as overcoming and empowered, and whatever's going on with your health, then that may actually increase your self-concept, whereas on the other hand, if you feel overwhelmed by the disease process and what's going on with your health, then it's going to negatively affect your self-concept. How do we assess people for this? We focus on personal identity, body image, how they feel about role performance, and self-esteem. So if you have stressors identified during your assessment, then you want to find out how the client views the stressor. Just like we talked about, perception is kind of the reality on this. So the same stressor will not have the same effect on different people's self-concepts. So personal identity is questions like, who do they believe they are? Have them describe themselves to you. How do they think that others describe them? What do they like and dislike about themselves? What do they feel are their strengths and weaknesses? What would they change about themselves if they could? Body image looks more at functional and physical issues, behaviors related to any problems. You can ask him if they could change a body part, what would they do? Or how do they feel about their appearance? How do others react to any changes that have occurred, such as like how does their significant other react to changes in their body based on their illnesses? Role performance looks at how is their illness affecting their satisfaction or dissatisfaction with their role performance. Ask them about their family and home life. Ask them about work, if they're a student, how it's affecting their social life also. Ask if they feel successful in the roles that they're maintaining. What do they want to change? Do they feel proud of themselves? Do they feel like family members are also proud of them? As far as work, ask them what they do, how they get along with people. Ask them about hobbies. Ask them where they go to seek help if they need help. Self-esteem is going to focus on, is your client satisfied with life? How do they feel about themselves overall? Do they feel like they're accomplishing their goals in life? You do have to include cultural aspects. And think about cultural aspects when you're assessing self-esteem. Things like eye contact and stooping and unkept appearances or hesitancy to communicate may be seen in Western culture as negative self-concept or self-esteem, but they may actually just be cultural differences in communication sometimes. Planning, as usual, you're going to collaborate with your client and their support system in planning, set goals and outcomes, make sure to individualize things for your client. When we implement regarding self-concept, we're going to identify areas of strength and seek to enhance self-esteem. So, look for areas of strength. Sometimes that's harder than we think. We tend to focus on our negatives instead, and clients with self-concept issues are even more so going to focus on the negatives. So it may take you a while, and you may have to push for them to find those positive things to build on. Stress positive thinking, take note and verbally reinforce their strengths. Say them out loud to them, acknowledge their strengths to them. Set attainable goals. We'll talk about this more when we get to Site 2, so that your client can get those little successes that will help them build their self-concept and propel them towards higher successes. Acknowledge goals they've already attained. Be honest, but also positive. How do we enhance self-esteem? We simply building a therapeutic relationship alone with your client is likely to enhance self-esteem for your client. Encourage your client to evaluate situations, express feelings, ask questions. Identify any inappropriate or unrealistic standards they may have for themselves or labels that they place upon themselves. Once again, focus on strengths, positive qualities. Encourage them to express out loud positive self-evaluations and avoid criticizing themselves. Encourage positive self-talk. And evaluation. In evaluating the effect on self-concept, you look at have old situations recurred, have they returned to lower self-esteem, how are they maintaining that self-esteem that they're working on? Are there new situations that are causing them difficulties adapting and threatening their self-esteem? Are significant others supporting them and improving their self-esteem or causing problems with their self-esteem? Did they follow through on any referrals you've given them? Have the expectations been met? Do they need more time? Do you need to modify your goal for their self-esteem? I think that gets us through everything. Okay, your in-class activity is loaded on Blackboard. So if you have like a phone or whatever to get on there and read, you can get to it on there. I'll double check to make sure. Posted here, but it's going to be hard to read on the screen here. And it should have opened up at 1:30, so I'll let you guys look and tell me what you think.
Yeah.
Yeah. Keep that back there. Exactly.
You spend time with,
Oh, that's why.